call the member for Morani.
I rise to speak on the Health and Other Legislation Amendment Bill No. 2, 2023. Once enacted, this bill will make Queensland the first jurisdiction in Australia to allow midwives, nurses and other prescribed health practitioners to perform medical terminations using abortion drugs like MS2-step, drugs which are currently only available via a doctor. And I have significant concerns over this use of nurse-led medical abortion care and the possible health and safety risks which could be involved for those women living in rural and remote areas of the state. According to Dr Gino Piccaro, President of the National Association of Specialist Obstetricians and Gynaecologists, 5% of all medical abortions result in complications, including uncontrolled bleeding. And not one to beat about the bush, Dr Piccaro said of the bill's changes, someone could die from this. Similar concerns were raised by the Australian Medical Association of Queensland, the AMAQ, who told the committee that it is not safe for registered nurses to administer these medicines outside of a collaborative setting with appropriate clinical oversight. According to the AMAQ submission, prescribers must be able to accurately date pregnancies, exclude ectopic pregnancies via a pelvic scan, determine if patients are at risk due to other existing conditions, and ensure escalation pathways are available, including access to local emergency health care, usually within 2 hours' drive. Unfortunately, it is often the case in rural and remote areas that patients do not have this access, and even medical practitioners cannot safely prescribe MTOP medicines. Extending prescribing authorities to RNs in this context would not result in an increased access and could put patients at risk. The bill includes a regulation-making power that, according to the Health Minister's introductory speech, will allow additional types of registered health practitioners to administer these termination of pregnancy drugs in the future. According to the Minister, this allows flexibility to adjust the legislation over time to extend the access to termination of pregnancy services as other cohorts of health practitioners become suitably trained, qualified and experienced to perform medical terminations of pregnancy, such as Aboriginal and Torres Strait Islander health practitioners. Clearly, the bill's framework has been deliberately crafted for much wider application over time, and this is concerning on a number of levels, particularly the suggestion that these practitioners to be prescribed at a later date by regulation may ultimately constitute a specifically trained task force for the provision of abortion services to vulnerable women throughout Queensland. Even if these concerns are misplaced, I strongly oppose any future expansion of the bill's provision beyond nurses and midwives, particularly given the life-threatening complications associated with the use of these drugs. There is also a potential danger the bill's changes will lead to a creation of a two-tier medical system whereby vulnerable women in rural and remote areas will be at much greater safety risk when undergoing these procedures. Other concerns include the bill's preemption of several Commonwealth reviews on risk involved in non-medical prescribing by health practitioners, and that the bill's changes will expose nurses and midwives to professional, legal and insurance risks which they are not appropriately remunerated for. Deputy Speaker, the bill places a heavy burden of responsibility on Queensland nurses and midwives, most of whom are already struggling under the pressure of an under-resourced, understaffed and underpaid health system, and the government claims this bill will address the unmet medical needs within Queensland's rural and remote communities. However, I'm yet to see any evidence or data to support it. The contention that such an unmet need actually exists. Most women I speak to in the regions tell me number one unmet need they are concerned about is the chronic lack of adequate and safe maternity services in rural and remote towns and communities, as a member for Callide reminds us so regularly of. If Labor is truly genuine about meeting these areas of unmet health needs, they could start by improving the quality of maternal healthcare services in the regions and stop shutting down all the maternity hospitals and childcare centres. Deputy Speaker, the bill also amends the Termination of Pregnancy Act 2018 to provide for more inclusive language to be used when referring to abortions. Accordingly, any reference to a pregnant woman will now be substituted by the more trans-inclusive pregnant person and pregnant people. Minister Shannon Fenneman said the bill strengthens legal recognition of transgender and gender-diverse Queenslanders and ensures that all pregnant people can access medical terminations, including those who are transgender or gender diverse. Both the Queensland Nurses and the Midwifery Union, a QNMU, and the Queensland Aboriginals and Islander Health Council expressed concerns over the bill's changes in this regard, as did a number of the other submitters. QNMU said retaining the term woman in legislation was an important safeguard for the specific rights and experiences of women. Removing this safeguard would only serve to make biological sex less visible. According to the international research paper published in 2022 by 10 prominent women's health researchers, stated that replacing words like breastfeeding with terms such as lactating parents risks reducing protection of mother-child bond and disembodying the undermining breastfeeding. And the authors argued that desexing the language of female reproduction has been done with a view to being sensitive to an individual's needs and as beneficial, kind and inclusive, yet this kindness has delivered unintended consequences that have serious implications for women and children. A co-author of the paper and former president of the College of Midwives, Jenny Gamble, told the Sydney Morning Herald that sex-based language is important due to sex-based oppression, and that confusing the idea of gender identity and the reality of sex risks adverse health consequences and deeper, more insidious discrimination against women. Professor Gamble also said, pregnancy, birth and early motherhood are fundamentally sexed issues, not gendered. Pregnant and birthing women and new mothers and their infants have unique vulnerabilities and also require protections. For decades now, women have campaigned for more biologically targeted studies and research aimed at better understanding women's health and the difference between the sexes. Instead, Labor is putting up the bills that will make the study of women's health impossible by erasing biologically accurate terms such as women and mother. Last year, the former Attorney-General Shannon Fennerman went so far as to cite a person being misgendered in a hospital as an example of a possible hate speech crime. And I think this is a mad agenda to abolish the word mother, which permeates our language and goes back thousands of years and is absolutely appalling. And I love my mother. Labor agendas to erase women and deny biological reality will get no aid or quarter from me whatsoever. Finally, I would just like to make a few comments on the process and the procedures around the introduction of this bill with the utmost respect to the committee members and the committee chair. The committee's report was only released on Monday, and here we are voting on a bill just 2 days later. No time has been allowed for members to read or properly consider the committee's report, let alone conduct any discussion or debate on its contents. This is particularly egregious, given that the bill has radical changes which drew 3 statements of reservations from members of the committee, including myself. The whole process around this bill has been rushed and cursory, starting with the consultation process. According to AMAQ, the government gave targeted government stakeholders just 1 working week to provide a response on the bill's consultation paper. As the AMAQ said, it is unacceptable that Queensland Health persists with this targeted and secretive approach to legislative amendments and does not act with transparency and accountability, Madam Deputy Speaker. So once again, the House is being forced to wade through extremely radical and consequential legislation without even a semblance of parliamentary scrutiny or debate. It just goes to show how the government is utter contempt for the parliament and the democratic processes that are built into it. Under Labor's state committee system, which is supposed to fill the gap left by an upper house in Queensland, has degenerated into little more than a tick and flick exercise in futility. This government's undemocratic approach to lawmaking is a direct consequence of a commanding dominance on the floor of parliament, a dominance no party should be allowed to enjoy with democracy. Let's hope the people of Queensland take steps to remedy the situation at the next election. Thank you.